105 Won the Buzz. I am Sheryl, and I am joined by Dr. Michael Workman. And boy, do I have a long list of questions for you today.
Okay, I better put my thinking cap on
here,
here,
I had no idea what you were walking into today.
Okay.
Well, I just got back from Hawaii.
I heard that.
A lot of pool time, and I'm afraid I might have been that creeper person that was staring at everybody.
Okay.
Well, I'm curious, what can be done after liposuction, maybe even years later, if someone's not happy with the contour?
Well, no, and I think probably it's important to put out there that probably 10% of the time after we do liposuction, we'll go back and do a little touch-up. We'll take out a little bit more, maybe smooth it out a little bit better. I think it's important if you're not happy, go back and talk to your surgeon, and oftentimes you can work with them and they'll set something up. So having said that, in your case, hypothetically, sometimes we'll do CoolSculpt in terms of, I think sometimes we can get some more evenness, but oftentimes we will go in just, oftentimes under a local anesthetic, numb up that area and go in with some real small cannulas, kind of loosen things up. And we don't necessarily take out that much more fat, but it can really improve the appearance if you've got an area, you're not happy with.
Let's say somebody comes in for a consultation. How do you determine if they're a good candidate for CoolSculpting, or if maybe they need more traditional liposuction or even a tummy tuck?
Right. Well, it comes back to anatomy. It's anatomy. And I think that those people that have quite a bit of fat are probably better candidates if they're healthy for traditional liposuction. If you're having problems with the selfies, with little fat under your chin, for having bra strap fat, and if we have a mild to moderate amount of extra fat in the abdomen, oftentimes CoolSculpt works very well. I saw a patient today that had a fair amount of fat in her truncal area, and we're probably going to do liposuction in her abdomen and kind of love handle area and legs, and then go ahead and do CoolSculpt on her chin and on her back and on the arms. It's a CoolSculpt is so I think it really depends upon the person. I think it's important to go to a doctor that offers all of these technologies.
And that's why the consultation is so important, so they can look at you and see what you need individually.
Absolutely.
What about, I know a lot of people, especially this time of year, are on weight loss journeys. And two questions that kind of go along with this. How close to their goal should they be before they do CoolSculpting? And does weight loss affect the result at all after the fact? And then what about loose skin?
Okay, well, a couple questions there. I think in general for plastic surgery, we like to have patients within 10 to 15 pounds of their goal weight, so that we especially with breast surgery, we don't like to be operating on a moving target. Some women are very sensitive to changes in weight with their breast size. So I think in general, if you're within 15 pounds, because you might not make it, you might not make your final goal.
Yeah, realistically, yeah.
Yeah, and I think that goes for, both for CoolSculpt and for liposuction. Getting back to question 2 in terms of the skin elasticity, I think if you've got hanging or really loose skin, we need to probably think about removing some of the skin as opposed to removing the fat underneath it. Because the fat underneath is kind of the cushion that plumps it up.
Yeah.
If it's hanging to begin with, you probably don't want to remove more fat.
So where would scars be hidden? Let's say they've been on a weight loss journey, they've lost a considerable amount of weight, and good for them, but now they've got this hanging skin in their middle.
In the abdomen?
That they're not happy about. Where would you hide the scars so they don't look like Frankenstein on the beach?
No, absolutely. Where we put the scar there is we put it underneath the bikini lines.
It sounds like, in addition to looking better in your bikini, I mean, low riding jeans, crop top, you're not going to see anything, but you need to get in and see Dr. Michael Workman. And especially right now, you should call and set your appointment because they're offering 15% off CoolSculpting procedures right now. And you definitely want to get in on this revolutionary new technology and look your best. drmichaelworkman.com for more info. Thanks for stopping by. Thanks for all the info.
My pleasure.